PCPLD Network are reaching out in response to the Public Health England report published earlier this week about COVID-19 deaths and people with a learning disability. The findings of this report were extremely distressing. People with a learning disability are 6 times more likely to die from COVID-19 than the general population. Here is the response from 2 of our members.
It's really bad that people with learning disabilities are dying of COVID for no reason and also not getting the right support in hospital. It was bad enough before COVID, but now it's even 10 times worse. People with learning disabilities should have the right support in hospital, and their families should be told what is going on, not for them to get a phone call to say that their loved one has died of COVID and they've had no one there to support them. And it's dreadful, upsetting, and it definitely shouldn't be happening. And I think the government should do something now rather than later. Just because we've got a learning disability doesn't mean that we should be left to rot in the corner and not have our rights just because we've got a disability, and it's definitely not fair. I'm really angry, and we need the support now rather than later. And I hope the government is going to listen to this message.
This report is really shocking. The numbers are so devastating. But what really upsets me is that so many of us have seen this coming. Way back in April, at the start of the pandemic, families and learning disability services were trying to draw attention to the fact that people with learning disabilities were going to be so much more vulnerable to the effects of the pandemic. Because we know that even before the pandemic, people were already dying before their time. People with learning disabilities die on average 25 years younger than the general population. And that is not just because of underlying health conditions that they may have, it's because of failures in the healthcare system. Problems not being picked up in time, not being addressed properly, not being treated in time. So it's not surprising that the pandemic is just going to make things so much worse. And this has just been made so much worse by the lack of support that has been available for people with learning disabilities during the pandemic, the lack of PPE for staff, the lack of testing available to people with learning disabilities and homes for people with disabilities, the lack of support for people to cope with the lockdown restrictions or to cope with hospital admissions. It's really been terrible. So what we need now is immediate action, and there are a number of things that we would like to see happen. Number one, once the vaccine becomes available, people with learning disabilities should be right at the front of the queue in recognition of their extreme vulnerability to this virus. And that is not just older people. As we have seen, young people with learning disabilities are 30 times more likely to die of coronavirus, so they need to get the vaccine first and fast. Secondly, we want to see regular testing for all people with learning disabilities, even if they don't have symptoms, and for all their staff and for all their families. And thirdly, there should be sufficient funding and support and resources for staff and families and learning disability services to provide the support that people with learning disabilities need to cope with what can be a really frightening and difficult situation.
There are over 1 million people in England with a learning disability, and their lives matter. We are calling for immediate action to prioritise people with a learning disability and address the health inequalities and avoidable deaths that one of our most vulnerable groups experience. If we don't address the unacceptable COVID-19 death rate with funding and with policies, then we will have failed them.